Probably the way to think about this is kind of starting out with preventing the disease, and then the other end of the spectrum, which is someone who has a heart that doesn't pump blood sufficiently anymore, and unless you replace their heart with something, they're going to succumb from the heart disease. So starting on the severe end of the spectrum, we put in what's called a ventricular assist device, or a VAD. And a ventricular assist device I would think of as an artificial heart. You basically put large tubes into the heart so that you can take the blood and put it through a pump. The pump is essentially implanted in the chest, and using a battery, it will actually take over the heart's function. And these are now implantable. They can last indefinitely for years. The former Vice President Dick Cheney had a ventricular assist device for 3 years before he decided to have a heart transplant. So this is a big step forward, and Hackensack is one of the places where you can get a ventricular assist device implanted. It's a big procedure, but it also takes somebody with severe end-stage heart failure and makes them feel well again. So it's a great form of therapy. If somebody goes into a heart rhythm called atrial fibrillation, the atria of the heart don't contract anymore in a regular fashion, and you can develop a clot inside the heart, and that clot can go up to the brain and produce a stroke. So there is a way of getting rid of the area where the clot forms. It's called the left atrial appendage. So this is called a left atrial appendage occluder device, and Watchman is the brand name for this particular device. And we've put in a bunch of these now. We have a lot of expertise. It's a very good technology, and you don't have to take a blood thinner for your atrial fibrillation if you have a Watchman device placed. So that's another new technology that prevents stroke, essentially. So it's an exciting new technology. So there are 5 million people in northern New Jersey, speaking as somebody who was born in northern New Jersey, I think that you should be able to get your medical care somewhere, reasonably close to home. Hackensack, I think, should really provide care that's as good as or better than every place that's on the other side of the river. This is not to say anything negative about New York. I go there commonly myself to get a good meal and things like that, but the fact of the matter is your medical care ought to be, able to be done in New Jersey. I've been at a few other institutions. I lived in Illinois for a while, and there are large areas of Illinois that have, sparse population and pieces of the Midwest and such. And in that situation, your local physician needs to have contacts with places like Hackensack, and we get a lot of transfers actually from different parts of New Jersey of people who need these advanced procedures. We do them and we send them back, to their own physicians. And most of the time, most of the follow-up can continue to be at home. Occasionally, things like a ventricular assist device requires very special knowledge, and so we have to see that patient on a regular basis. But usually they go back, to their local physician.